Good afternoon, Linda. Not so much celebrations on the agenda, I understand, but more about problems that nurses have been facing. What has come out of this meeting?
Well, it's all about the issues, Britain, that nurses face on a daily basis. And one of the things that they spoke about there was the issue of some of the issues that nurses face, particularly during COVID-19, saying that there is a lot to be desired, there is a lot that still needs to be improved. And in fact, one of the utterances is the fact that nurses were ever so ready to face anything, any pandemic, because that is part of their training. But the support from the system, the support from those that are managing this particular pandemic is the thing that is leaving too much to be desired. And one of the things we understand is that the nurses, as much as it is a celebration about them today, they want the issues to be resolved. And one of those issues is the issue of enabling nurses to be at the forefront of leading the changes within the sector of healthcare.
Well, NEHAW, of course, is an affiliate of Trade Union Federation, COSATU. They are also taking part, Linda Gutla, I understand, in this seminar, and they are concerned about wages.
Well, COSATU coming out strongly saying that the wage freeze is one of the things they are looking to be leading at the forefront for, saying that they do not believe that nurses should be the ones that are sacrificing both their time, both their lives, and at the same time not be compensated for that. But COSATU, through their president, saying that one of the things they will be doing moving forward is to lead this particular fight to ensure that nurses actually get the compensation and remuneration that they deserve, particularly during this time. And one of the things they said was that, in fact, they should not be speaking about the wage freeze. They should be speaking about the compensation for the dangers that nurses put themselves through, particularly during the pandemic. But let's take a listen to the president of COSATU, just giving us a sense of what it is they believe that, in fact, should be looked at by government when it comes to compensating the nurses.
Nurses and other health workers have been carrying the nation on their shoulders. Yet government has walked away from the last leg of the 2018 wage agreement and imposed a 4-year wage freeze on public servants. Yes, we know that government is facing a serious fiscal crisis. But comrades, this is not the fault of the nurses. Government has allowed politicians and their families to loot the state to the point of bankruptcy. They have run the state-owned entities into the ground, and thus inquires endless bailouts costing billions.